prepares food for use by the body's cells, and then responsible for elimination of solid waste from the body. So the body uses all of the nutrients that it can, distributes it throughout the body, and then any waste is then eliminated. The oral cavity, also known as the buccal cavity. Whenever you hear buccal, we're talking about the mouth. And that includes the lips, cheeks, hard palate or rugae, soft palate, uvula, which is the hanging little tube in the back, and the tongue. The tongue is the main organ we use for taste, and it also assists in chewing, which is also called mastication, and swallowing, deglutition. Here's the mouth. We see the uvula hanging there in the center, the tongue with the taste buds. The teeth, you don't need to know the teeth. We're not, unless you're going to be a dentist, you'll learn that in dental school. Cheeks, the rugae, which is part of the hard palate. Hard palate is at the top because it is a harder cartilage. The soft palate is at the back, which is more soft tissue. The gingiva are the gums. So the other term for gums are gingiva. You'll hear of gingival disease, gingivitis, and that's all, that the dentists deal with. It's the gum disease in the lower lip. Papillae are the little small bumps on our tongue. They're called villi or papillae, and that's all part of food. Okay, the salivary glands in our mouth. Of course, we're well aware of them. There's 3 pairs of salivary glands: parotids, submandibulars, and the sublinguals. Sublinguals are under the tongue, submandibulars are under the jaw, and then the parotids are at the back of our throat. They secrete saliva. It's mostly water, but it does contain mucus and digestive enzymes. So we start, as we're chewing our food, we actually start to digest it with the enzymes in our saliva. The digestive enzymes that are in our saliva include amylase, which breaks down carbohydrates, and lipase, which help digest fats. Whenever you see LIP, that will always be lipids or lipase, which means fats. Pharynx, also known as the throat, and it's a passageway for both respiratory and digestive. So we breathe through there and also swallow. And we talked about a week ago about the epiglottis, which is the flap that will cover the tube when we swallow so that food doesn't go down our air pipe. Occasionally, we may be talking and eat and then breathe at the same time that we're swallowing, and food will go down the air pipe and we'll choke and cough. The oropharynx leads away from the oral cavity. So it's the first part of the tube at the back of our throat. Naropharynx is behind the nasal cavity. So the pharynx is that structure at the back of our throat. Oro is at the mouth. Nasopharynx is higher up. Laryngopharynx is the lower portions, open into the esophagus and the larynx. And we know the larynx is our voice box. The esophagus is the food that then goes to our stomach. Is the tube that then goes to our stomach. It receives food from the pharynx and then propels it into the stomach. So when we say propels it, it doesn't just drop in by gravity. It actually has what we call peristalsis, and that is the tube actually undulates and pushes food down. It actually the tube itself pushes food down, so it propels it to the stomach. The cardiac sphincter is really also known as the lower esophageal sphincter, and it controls the passage of food from the esophagus into the stomach. So that sphincter is the sphincter that is between the esophagus and the stomach. And the idea is we want to have that closure of the esophagus because our stomach contains acid, and you don't want that acid to shoot back up the esophagus because it will burn the esophagus. So we all hear of heartburn. Esophageal reflux syndrome is what we call it. But it's heartburn is where the acid somehow gets through that valve and shoots into our esophagus, and you'll feel the burning, and it hurts, and there are drugs to treat that. Sometimes, especially as you get older, maybe if you have a virus, the esophagus, the sphincter, the cardiac sphincter, will not close as well as it should, and so you will get acid shooting up, and it burns. And then certain foods can cause you to have more heartburn, as we call it, than you normally would. So when it relaxes, food enters the stomach. When it contracts, it prevents the food in the stomach from re-entering into the esophagus because it contains a high amount of acid. So the stomach is broken up into different parts. The fundus is the upper rounded part or portion. The body is the central part, and then the pylorus is the lower tubular area, the gastric antrum. AN means lower. And it has the pyloric sphincter, which regulates the passage of food from the stomach into the duodenum. The duodenum is the first part of the intestine. So we have two sphincters, one at the opening to the stomach, the cardiac sphincter, and then one before the intestine, the pyloric sphincter. And the idea is that, the acids and the stomach will churn the food, and then when it's time, it will allow it to go down into the duodenum. Rugae are the folds in the mucous membranes of the stomach. So if you were to look at it, if you were to open a stomach, you would actually you'd see all these little folds in there, and that's where, the acid is secreted, food gets mixed in there, the stomach actually, moves and churns the food. And so the rugae is the mucous membranes of the stomach. So the gastric juices in the stomach break down the food. The muscular action of the stomach causes the churning of the food. So it mixes the food with the secretions, breaks it down, and it becomes this mixture called chyme. It's liquid-like mixture of partially digested food and digestive secretions released in small amounts through the pyloric sphincter into the small intestine. If you wondered what that looks like, if you vomit, that is chyme that's coming out. And that means, for some reason, whatever is in that chyme may not be good for you, so your body may be trying to expel it. So here we have the description. We see the esophagus, that's where the sphincter is. The fundus is the top part of the stomach. The stomach has an outer lining called the serosa, and it's muscular. It is a smooth muscle. We talked about the smooth muscle, which is involuntary muscle, which moves on its own. We don't consciously move it as we do with our arms and legs. And then the body of the stomach is the main part. You don't need to know this, but there's the greater curvature and the lesser curvature. The lesser curvature is on top, it's smaller, and then the greater curvature is at the bottom, and it's the main curvature of the stomach. Pyloric sphincter, here's the other sphincter at the base of the stomach. And then it opens into the duodenum of the small intestine. So we know the entire digestive system is 30 feet long. 20 feet of that is just the small intestine because it folds in and back and forth among itself. Also known as the small bowel, broken into three parts. And you should know this: the duodenum, the jejunum, and the ileum. The duodenum is at the top, jejunum is in the middle, the ileum is at the end. of the small intestine. So food continues through these 20 feet of the digestive system, the intestine, and then through absorption, it absorbs the nutrients out of the food. So the stomach breaks it down with acid. It goes through the intestine, and then there are villi. Villi mean little tiny folds. And so there's more surface area. So as the chyme goes through and kind of goes into these villi, the lining will absorb the nutrients, and then it'll go into the bloodstream and then go throughout the body to nourish the body and all the cells in the body. From the 20 feet of the small intestine, it now goes into the large intestine, and it's broken up into 3 parts. Top part is the cecum, and it's the appendix hangs from the lower portion of the cecum, and we'll see that in the drawing. The ascending colon is the middle. It's also called the hepatic flexure. Hepatic, we know, means liver, so it must be near the liver. And then the transverse colon, or splenic flexion. And transverse meaning it goes across, so we'll see that. Large intestine, descending colon, sigmoid colon, as we continue down, descending colon, sigmoid colon, rectum, anus. Okay, so let's look at it here. So we see the very first part coming out of the stomach from the pyloric valve is the duodenum. So it's the very first part. Then as it goes down and goes into this part where it folds among itself, that is the jejunum. So this is all the jejunum. The mesentery is it's a tissue that attaches and holds everything together. It kind of suspends all of the intestines. And we have mesentery throughout our body, but it is vascularized, thin tissue that kind of suspends everything. And then as you go further down, we see the ileum toward the bottom after all the ins and outs. And then the cecum, the ascending colon, and then the cecum. And then you see the appendix. The appendix is this little thing hanging off. You always hear of appendicitis. And that is where food gets into that little appendage and then it gets infected. And that's when you get pain, and then they need to go in and remove that. We still don't know really what the reason for the appendix is. There's no real reason for it. Maybe there was maybe a million years ago or so, but we don't really know. But you can get appendicitis, and then it needs to be removed. Okay, so now we go into the large intestine, and then here it comes from the ileum, and then we go to the cecum, the ascending colon. So ascending means it goes up. Transverse means across. So the transverse colon is now large. These are a much larger intestine than we saw in the small intestine. So it goes up to the transverse colon, which goes across our abdomen, and then the descending colon, which goes down. Then the sigmoid colon, which curves. That's what sigmoid means. So it curves. Then it goes to the rectum, and then the anus. True or false? This 30-foot digestive tract from mouth to anus breaks down food into what the body can use and gets rid of what it cannot. Absolutely true. Breaks it down to a cellular level. Any questions on any of that at this point? Okay. Okay, next we have liver. Also, whenever you hear the word hepatic, it refers to the liver. So hepatic artery, hepatitis is a disease of the liver. Anything with hepatitis, hepatic in it is the liver. It's located immediately under the diaphragm, slightly to the right. The only function is production of bile for emulsification of fats in the small intestine. So emulsification means to take fat and suspend it in another solution, rather because fat kind of stays together. And if you mix it with another solution, you may have a layer of solution and a layer of fat. Well, when you emulsify, you actually break it up into like little globules that are suspended throughout. An example is a salad dressing. When you get a bottle of certain salad dressings out, say oil and vinegar, you'll see two layers, and you shake it, and then you emulsify it and break up the fats into little globules that suspend throughout. And that's what bile does with the fats. Additional functions of the liver. It excretes bile pigments into the bile, which usually is a greenish color. Synthesis of vitamin K dependent plasma proteins. So we mentioned once that vitamin K has to do with our clotting. So we need vitamin K to clot our blood. It's part of this whole system. And the liver actually will synthesize vitamin K. Metabolizes amino acids, carbohydrates, and fats. Phagocytosis, we said phago is the Greek word, it's a Greek root meaning to eat. So phagocytosis means it eats bad things in our blood, things that are dangerous, so we'll go in and eat that and destroy it. Detoxification, so removing the bad poisons, and storage of vital nutrients. So the liver is very important. You can have a liver transplant. You need the liver to live, so you can do a liver transplant. We can also, the liver is one of the only organs that regenerates itself. So you can actually take part of the liver from someone, transplant it, and it will grow and function as a normal liver.
So if yours is damaged itself, do you have to do that, like get it from someone else, or can it regenerate by itself too?
It depends on how badly it's damaged. If it's damaged, if it's damaged, but it can heal, then it may be okay. They can do tests to see how well it's working. But if it's so badly damaged it can't be, then you would need to do a liver transplant. One of the diseases that we've treated over the years is something called hepatitis. It's a virus that attacks the liver. And it could eventually, stop your liver from working over time. But we've actually come up with drugs about 10 years ago, very expensive drugs, but drugs that work that will kill the virus and cure hepatitis. The problem is when you have hepatitis, it's a virus, so you can actually give it to other people. If you use a razor and hand it to someone and they use it, they could get hepatitis from you. So by curing with the drugs, you take it for about 12 weeks, cost about $1,000 a day. We did a lot of work with patients on this as pharmacists. It will actually cure it in many ways. We also, when we use the hepatitis drugs, it has to do with what we call genomics. We actually do gene testing on the type of hepatitis to see what gene base it is, so that we can use a certain drug that will match that. So it's one of the first diseases where we're using gene therapy. But I had a patient who I helped get the drug, helped find a way to pay for it, and then he was very happy because now he said, I can get married, I can go on with my life now that I'm cured. So just an aside.
That's awesome.
Okay, gallbladder. It's a pear-shaped sac located under the surface of the liver. Main function, to store and concentrate bile produced by the liver. So it takes the bile from the liver and stores it and concentrates it. It releases it in response to the presence of fatty content in food present in the duodenum. So the bile will actually, as we said, it'll emulsify the fat, and it'll allow us to use the fat and then also to excrete any extra fats we don't need. And the gallbladder is one of the organs that you hear of people who have gallbladder surgery where it has to be removed because you can get an infection or rupture and then it's removed. You can live without it. You may have to take some special enzymes that the gallbladder would normally make, but you can live without it. It's one of the things. Liver you can't, but the gallbladder you can live without. Pancreas, very important organ located in the upper left quadrant of the abdomen behind the stomach. So it's an exocrine gland to manufacture digestive juices. So the different juices are trypsin, and you don't need to know this part. You don't need to know to this detail, but just so you're aware, trypsin breaks down proteins, pancreatic lipase. So we said LIP means lipids or fats. And then whenever you see ASE, usually it means it breaks it down. So lipase breaks down fats. Pancreatic amylase. So amyl means protein or carbohydrates, and then ACE breaks it down. So pancreatic amylase will break down carbohydrates. Sodium bicarbonate neutralizes the acid in the stomach. So sodium bicarbonate is a base. We have acid in the stomach, and the sodium bicarbonate will actually neutralize it because we can't have acid going everywhere. Everywhere it's going to burn all different parts of our intestines. So we use the pancreas will actually create sodium bicarbonate to neutralize it. It functions as an endocrine gland to manufacture insulin and glucagon. So we all hear about diabetes, type 1 diabetes, type 2 diabetes. And that has to do with the pancreas not being able to manufacture insulin correctly. We need insulin. It's a hormone that allows our body to use the sugars in our blood and allow them to go into the cells. If we don't have insulin or the insulin isn't working correctly, we'll have sugar in our blood, but it can't go into the cells and the cells actually start starving. So you end up with high blood sugars. The normal blood sugar is around 100 or less if you haven't eaten. If you're eating, it's like 130. If you get into, an abnormal diabetes blood sugar would be 200, 300, 800 even in very bad cases. And that's because the insulin isn't either isn't there or it's not working correctly. And so all that sugar stays in the blood, causing trouble and not being used by the cells, and the cells start starving. Insulin promotes the conversion of excess glucose into glycogen. So the extra glucose in our blood, if we've eaten a lot of sugar, will be broken into glycogen, and then it secretes glucagon, a hormone that stimulates the liver to convert the glycogen into glucose when needed. So the liver will actually store the glycogen. And then when we need sugar, it can actually turn it into glucose through the pancreas, and then the body can use it. Teeth, of course, we need that for mastication, which means chewing. Breaks it down, and the saliva starts to, even in our mouth, break down the food. Primary teeth. So in children, the deciduous teeth, when young children are born at about 6 months, sometimes younger, my kids were younger, they begin to grow teeth. Those are the deciduous teeth. There's 20 teeth. Secondary teeth are the permanent teeth that begin around age 6, and that's when kids their teeth fall out, and then new teeth start growing in. Those are the secondary teeth. Incisors, chisel shape with sharp edges for biting food. The canine or cuspid teeth for grasping and tearing food. They got bicuspid premolars and molars, flat surfaces, multiple projections for crushing and grinding the food. The crown is the visible part of the tooth, covered with enamel, which is the hardest substance in the body. And then, when we get decay, then that's where sugars and other things have broken down the enamel and then gone and started to destroy the tooth. And that's where we have to get fillings and things like that, root canals. Of course, the neck of the tooth is beneath the gum line. The root is in the bony socket of the jawbone. And then the root canal is, or pulp cavity, is the central core of the tooth. And that's where the nerves are in our tooth. Okay, so question, the ducts from the liver, gallbladder, and the pancreas all converge to empty into what part of the digestive tract? Stomach, colon, duodenum, esophagus. And the duodenum, we know it all goes into the first part of the intestine, the small intestine, where digestion is completed, nutrients can be passed into the bloodstream. So the duodenum, where it folds in and out for 20 feet, is where most of the absorption of the nutrients come from. After that, when you go into the large intestine, that's more for elimination. Here's the pancreas, this pretty good size organ here. Here's the liver. Below the liver is the gallbladder, and it's got the ducts for bile. Duodenum, common bile duct. When the pancreas isn't working correctly and it's not secreting insulin, or the insulin isn't working the way it should, then we have to give insulin by injection. And that is one of the best ways to treat diabetes. We have to learn how much to give for each patient. We start with a low amount and then slowly increase the amount of insulin to get it to just the right amount. And in most people, 2 injections a day. And if they test their blood sugar, they can get it down just right. And if they watch what they eat, they can get their blood sugar in a nice range of around 150 or below 200. In some cases, there are insulin pumps which will continuously put out small amounts of insulin, and they can do very well on that in more severe cases. Normally with a couple of subcutaneous, which means just below the skin injections that you can give yourself a couple of times a day, you can treat insulin pretty well. Of course, there are a lot of other oral medications we use too. Okay, achlorhydria. It's an abnormal condition characterized by the absence of hydrochloric acid in the gastric juice. So chlorhydria, you know, that has to do with hydrochloric acid. And then A, whenever we see A in front, it means the absence of or without. So anorexia, without appetite. So anorexia means you don't have an appetite. So we're going through some of the terms alphabetically. Aphagia. Phagia means to swallow, so that means without swallowing. It's loss of the ability to swallow for disease or psychological reasons. Ascites is the accumulation of fluid within the peritoneal cavity. You'll see ascites most often, and you'll see that the abdomen will become distended. And you can see sometimes older, well, people that have severe liver disease, they'll look very large. Their stomach will look, their abdomen will look very large and distended. And that's because all this fluid is in that cavity. And sometimes they have to take a syringe and draw fluid out. And that happens when the liver isn't working correctly. The sign of a pretty advanced liver disease. Orborgymus, it's an audible abdominal sound produced by hyperactive gastrointestinal peristalsis. So peristalsis is the movement, the involuntary movement of the intestines to allow our food to be pushed down. Even if we're asleep, it does that. So it's a rumbling, gurgling noise. So a physician or a practitioner with a stethoscope can listen to that and hear hyperactive peristalsis. Constipation, difficulty in passing feces, or an incomplete, infrequent passage of hard feces. Diarrhea, frequent passage of loose, watery feces. Dyspepsia is heartburn, vague feeling of epigastric discomfort after eating, involves an uncomfortable feeling of fullness, heartburn, bloating, nausea. Dyspepsia, also known as heartburn. Dysphagia is phasia means swallowing, dys means unable to, so difficulty in swallowing. Could be an obstruction in the esophagus or a motor disorder of the esophagus. The symptom may be relieved with Tums or Prilosec OTC. Aphagia, dyspepsia, dysphagia, or borborygmus. It's actually dyspepsia, heartburn or dyspepsia. And okay, we have, Tums. Tums is just simply calcium carbonate. So it's like sodium bicarbonate. You take the Tums, and it's got that chalky taste, and it just neutralizes the acid. That was like the first step. And then Prilosec will actually shut down the glands that release acid. It will actually kind of shut them down so you don't get that extra acid. Okay. But actually, there's another drug called like Pepsid and Tagamet that you can take, which is kind of in between the two, and that's over the counter, and that's actually what I would recommend before Prilosec. It's something like Pepsid or Tagamet over the counter. Works very well. Okay, we're going into the E's, emaciation. Excessive leanness caused by disease or a lack of nutrition. So if you're emaciated, it means you've basically been starved. Emesis is vomiting. Material expelled from the stomach during vomiting is emesis. Eructation. Eructation is bringing up air from the stomach with a belching sound. So it's burping. That's the term is eructation. Flatus or flatulence, air or gas from the intestine that's passed through the rectum. Gastroesophageal reflex. This is, again, heartburn, the backflow of stomach contents into the esophagus, often result of incompetence of the lower esophageal sphincter. So if you have a certain virus, sometimes it could weaken the esophagus for a while, or the sphincter, and you can get this gastroesophageal reflux or heartburn. And sometimes as you get older, you start to get heartburn. I know for me, if I eat like a hard, dry cookie, I'm going to get heartburn if I'm not eating it with something else. Icterus, it's a yellow discoloration of the skin, the mucous membranes, the sclera, also known as jaundice. So jaundice sometimes could point to a problem with the liver. And so it causes yellow discoloration. You're most likely going to see it in the whites of the eyes. Is one of the first parts you're going to see it before you start to see it in the skin. Melena is an abnormal black tarry stool containing digested blood. So whenever someone has a black stool, it could mean they have blood in their stool. That usually means there's a bleed further up maybe in the stomach, possibly the stomach could be bleeding, or the small intestine, because that means it's gone through the intestine, so it's been partially digested when it's black. Now, if you see fresh blood in the stool, then it means it's probably coming from the lower intestine if it's fresh. And then nausea, the unpleasant sensation leading to the urge to vomit. Pruritus ani is common chronic condition of itching of the skin around the anus. Steatorrhea. Steatorrhea. It's abnormal amounts of fats in the feces, characterized by frothy, foul-smelling fecal matter that floats. That's steatorrhea. That has to do with too much fat in the feces. It means your body may not be digesting fat the way it should. And then vomit, of course, is when the chyme is expelled from the stomach. True or false, nausea can lead to eructation and vomiting, which produces icterus. Okay, so yes, it can lead to eructation, which is burping and vomiting, but icterus is jaundice, and nausea cannot lead to jaundice. You may have nausea at the same time as jaundice, but it's not the cause.